Your focus on women allows organizations like La Comunidad Hispana to have a laser ability to wrap services around women. Specifically, the funds are used for our pregnant women. So some of you may know that in Chester County, the group of women, and we know it because we saw it in the blueprint as well, the group of women that are less likely to seek prenatal care early are Latinas. And when asked, the number one reason, money. If they do not have health insurance, a pregnancy is extremely expensive. So they delay care. And one of our goals at LCH is to make sure women know that we provide prenatal care from day one at no cost. If you cannot afford it, we will see you, we will serve you, and we're happy to do so. And the fund allows us to do that. Specifically, the prenatal care is given in a way that is holistic and understands the context of the lives that underserved women, especially Latina women in our community, face. And the story of Talia illustrates that. So Talia came to see us for her pregnancy last fall. She came in late into care. So she came in when she was 5 months pregnant. This was her third child. She had 2 children from a previous marriage. She had just moved to the area with her current husband, and she was pregnant with her baby from him. We did our intake, we were happy to see her, we caught her up on all of the immunizations, the ultrasound, made sure the baby was healthy, the baby was doing well. We wanted to get to know her, we wanted to get to know her partner. Her partner, charming, attractive young man. 2 little kids, gorgeous. We thought, great family. We saw Talia 4 weeks later because we wanted to catch her up on her care. And this time she came and charming husband was right next to her. A little too close. So our women's health specialists, our women's health providers, they are women's health nurse practitioners. So they're trained in women's health specifically, and they're midwives. And they understand the signs and symptoms of someone who may be potentially either suffering from depression or intimate partner violence. So they had an inkling, and our women's health provider, her name is Catherine, she said, hair stood up on the back of my neck. So she said to the partner, no, I need you to step outside because we're gonna do a woman's exam. So go ahead and wait in the waiting room, take the little kids, we'll just be a minute. And she used that minute in the exam room to do a quick screening. Now, Talia did not say anything about intimate partner violence, but she did, in a standardized assessment, test positive for depression and anxiety. So one of LCH's wraparound services that we bring to women is behavioral health. So immediately, our behavioral health specialist, who's a licensed clinical social worker, comes in, does another assessment. The Catherine, our women's health provider, goes out, says, hey, we're just gonna be a little bit more, we just need to do a quick ultrasound on the baby. The man says, no problem, smile, grin ear to ear. After the counselor left the room, she walked out and said to Catherine, we have someone who needs immediate assistance. The home is not safe. Talia lives in fear, and she lives in fear that her partner will do something not to her, but to her 2 children from the other marriage. And the reason why she thinks she will not be a victim at this point is because she's pregnant, but she is terrified that as soon as she gives birth to this baby, both her children and herself are gonna be in a very unsafe situation, and the new baby. She has no job, she has no phone, she has no friends. So not only do we have an immediate situation, so of course we bring in our partners from the Domestic Violence Coordinating Council, shout out, who are in LCH, they are co-located in our building. We bring them in immediately, we say, we need to work with you on this case. But we also have to create some guides in order to be able to continue seeing her, in order to get the kids in with her, in order to continue working with her on the safety plan, which the counselors at DVCC came up with. So this took her coming in every 9 days from essentially the middle of August all the way through the end of September, because it took that long in order to be able to work through a safety plan that was going to work for her, because each woman has to make her own choice about what she wants to do and how she wants to do it. And she said, I'm not ready. And we said, we're still here. So she gave birth at the end of October. We connected her with a public health nurse who would go to the house. Once the partner realized the public health nurse was going to the house, he said, you cannot come to the house anymore. So we said to the public health nurse, come to LCH. Because Talia would be able to tell her partner, I'm going to LCH for something else. The kids need a vaccine. I need to apply for health insurance. LCH is known for anything you might possibly need, just walk through the door. So she would create other stories about why she was actually coming. And she was coming to work with a public health nurse and LCH staff and her own counselors. So we really were able to wrap a blanket of support around her. And in November, right before Thanksgiving, she called, she said, I'm ready now. I'm really afraid, I'm ready now, it has to be today. So we were able to convene these folks around. We were going to go and help. We had the DBCC counselor, and they were going to go pick her up. She was 40 minutes away from LCH, and at the last minute she said, no, I can't. I'm really afraid I can't. So Catherine, her medical provider, called her and said, I'm going for you right now. So this was a medical provider. This isn't a counselor. This is the person she trusted who did her medical care, who went, picked her up, picked up the kids, were able to take them to the designated shelter. And I'm so happy to tell you right now that Talia is 6 months out of that situation. She's doing very well. She has found a job. And when we spoke to her a couple of weeks ago, she said she has 5 friends. And her baby is thriving, and the other kids are thriving. And we're just truly, truly humbled at LCH to be able to be the place where we believe we help people change their lives. And this would not be possible without organizations like the Fund, without the work that you're doing. So thank you so much to each and every one of you. And thank you for the opportunity to be able to do this great work in this wonderful